Well, hello there, my fellow warriors. Welcome to my brain wreck. So, my fellow warriors, my purple warriors, epilepsy warriors, and seizure people that have seizure disorders, even if you haven't been diagnosed with epilepsy, welcome to my channel. This is my brain wreck. I do this channel for people just to provide information for those who have epilepsy or some type of seizure disorders, and as for informational purposes only, not for medical purpose, because I'm not a professional. If you have any questions about your medicines or things like that, or your seizures going on, talk to your neurologist, or your doctor, or your medical team. And like I said, I get a lot of my information from epilepsy.com. So, what we're going to talk about today is Keppra, also known as levetiracetam, which is a very long word to say and pain in the butt to say. So, we're just going to call it Keppra from here on out. So, what does it do? Well, it's going to be used for a seizure med, help control your seizures and make them less frequent. So they say. So what comes along with that? How does it work? How does it affect the brain? And what is this Keppra rage that everybody talks about? Is it a mood changer? Is it changing your behavior? Do you out on it? Do you go crazy? Do you have more seizures, or do you have less seizures? How does it affect you? How does it affect your loved ones? How do they see you when you behavior totally changes when they're used to a behavior a totally different way? So, so how does Keppra affect the brain? Well, so like I said, I'm reading over here off stuff, right, and just giving us some information out. So basically, brain cells talk to each other using electrical signals and chemicals. Seizures can happen when their brain cells are not working or firing normally or working faster than normal. So most seizure medicines slow down these electrical discharges to stop seizures. So they're going to slow your cells down, or electrical charges, like a slow roll, like going a school zone. Slow down to a school zone to 25 miles per hour, so the highway 70 to 80 miles per hour. So Keppra works differently from most seizure medicines. It joins with a protein called SV2A that's involved with the release of certain chemicals called neurotransmitters in the brain. The exact way these actions lead to decreased seizures is not fully known, so they don't know how it works or exactly. So how does the body digest the Keppra? So the body absorbs, digests, and breaks down or gets rid of a medicine is called metabolism. So we all know what metabolism breaks down stuff and sends stuff where it needs to go into our cells. The way the body metabolizes medicine affects how often it must be taken. I myself personally are 3,000 milligrams max. So I take two 750 mgs in the morning, two 750 mgs at night. So that's a lot. So 1,500 in the morning, 1,500 in the evening. This process can also affect if it will interact with other medicines. If a person has liver or kidney problems, a person themselves may be affected. So always consult with your doctor and stuff, if you have liver problems and things like that, obviously, from what I'm reading over here. So you really want to do that. So some important points about the levetiracetam or Keppra. So like I said, I'm just going to say Keppra from out here from here because it's a long word to say. And a lot of time it gets mispronounced, and I can understand why. So the tablets and liquid take the same amount of time to be absorbed. So either if you're taking the liquid or the tablets, no matter what, it's going to take the same time amount to absorb into your body. So taking Keppra with food may slow down the time it takes for the body to absorb the drug by about 1 hour. So I'm guessing they want you to wait for an hour before you eat, obviously. So that's very interesting. I did not know that. Highest blood levels are reached in 1 to 2 hours after taking that dose of this medicine. So your blood levels are going to go up, I guess. So another point there. And that's one thing I did not know about that either. The liver does not affect how Keppra works in the body. So it doesn't affect how it works. But it might affect the kidneys some other way, I guess. The body gets rid of the drug through the kidneys because your kidneys are what clears out things and all the poisons and stuff, obviously. All right. But like I said, I'm not a medical professional or a doctor or anything like that. This is some things I learned in science and biology or whatever. This may affect how much Keppra a person with kidney problems take and how often they take it. So just take that in consideration and how often you take it and what it does. So how does the Keppra work? So not all seizure medicines work for everyone because there's people that are anti-seizure resistant and stuff, and That's why they have the RNS, VNS, and stuff that try to help them or whatever to listen to their seizures, or sometimes they'll take out stuff out of their brain, a little bit of a piece of their brain, which is, it's crazy, I know. So it's supposed to help listen to seizures or stop the seizures from happening again. Sometimes it works, sometimes it doesn't. So not all seizure medicine work for everyone. Your healthcare provider may try a series of seizure medicines or a combination of medicines to find out what ones that works best for you. Myself, like I said, I'm on Keppra. I'm also on a close of mine, or Vimpat, 200 milligrams total a day, 100 in the morning, 100 at night. So now it says over here, most studies of Keppra, when given the other seizure medicines, when given with other seizure medicines, 20 to 40% of people had at least a 50% decrease in their seizures. So that's for a study. That means that the number of seizures each month was at least cut in half. All right. So if you guys have any comments about that, let me know in the comments and stuff, and you tell me if you guys had any decrease in it or if it's made it worse. Now it says most people do not have many problems with the side effects in these studies, according to the studies. So I myself, I have not noticed any Keppra rage or anything like that, or change in my behavior and stuff. I did notice a change in my memory and got a little foggy and stuff. It's okay. It's fine for now, but medicines do different things to people. So at least one study found that Keppra may be helpful when used alone in people with focal partial seizures. All right. So focal partial seizures. So since this medicine does not interact with other seizure medicines, it is easier to use with other seizure medicines. So obviously that's a main go-to. Obviously for a lot of neurologists, I know is that and Vimpat or other ones. Keppra is like one of the number ones I think they go to use. So what are the common side effects of Keppra? Well, so in the early test of Keppra, people who took this medicine were only slightly more likely to stop the drug because of the side effects that people taking a placebo, an inactive drug. That's how they do their studies. They give you this, you think that's the medicine they're actually giving to you, which is actually not just the police, like it's a sugar pill basically. Some side effects may include dizziness, headache, irritability, loss of strength and energy, mood and behavior changes, and sleepiness. That I didn't notice I was getting sleepy from that, but I've adapted, so I've been on it for over 2 years now. So, and the Vimpat too. So some tips. So some side effects are more likely to happen in the first month of taking the drug. Some may go away on their own, but not necessarily. It may affect them really badly, and may, like I said, you might notice a change in the person that has epilepsy or whatever. If their behavior is totally out of control, you've never seen it like that before, and they could be smashing things, throwing things like that. But so taking consideration the person that has epilepsy or seizure disorder, it's not because they're going crazy or anything. If something's not working right, the medicine's not working right in their body and controlling their seizures the right way. It's causing irritability. So, but if you notice any of these problems, you want to call your healthcare provider. Change the amount or way the drug is taken may help. So you don't want to stop taking your Keppra or the way it is taken without your doctor's advice, because you really shouldn't do that and wean yourself off of it, because you're not a doctor or a medical professional, unless you are, unless you really do know how to do it. And I know some people do know how to do it, and they can be cut in half and stuff, but it's better to ask your doctor first, or your neurologist, or medical team. And just one more time, I'm not a medical professional. I'm just passing on information to you. All right, this is all I'm doing. Like I said, I get all my information from epilepsy.com. That's a good website to go to. It's epilepsy.com. All right. Now it says some people do report that the Keppra has had a positive effects. Well, I've seen a lot of people that said they have a positive effects on the board I'm on, such as feeling more alert, thinking clearer, and better concentration. But it's hard for whether these effects are from the medicine or from having less seizures. So it's hard to say if it's the medicine or they're having less seizures. Maybe it's both. So basically, when you're taking Keppra and stuff, avoid dangerous activities when first starting this medicine, or if taking larger doses until you see if you have any side effects. So probably no driving or anything like that, or operating heavy machinery or anything, stuff like that. Now, long-term side effects of Keppra have not been reported. So long-term have not been reported. That we know of yet, anyways. So, what are the most serious side effects of Keppra? Well, it says it says very few people had serious side effects from Keppra. It is important to be aware of possible reactions and what to do if they happen. In my humble opinion, I think there actually has been more people that had uh, more serious side effects from the Keppra rage, from things that I've understood and read and stuff, and articles and stuff, that it does affect them and does affect their mentality and stuff, and their memory and their psyche, and the psychological. So read the pack, very few people have serious side effects from Keppra. It's important to be aware of possible reactions, what they do if it happens, what to do if stuff happens. Now it says, make sure you read the package insert for more information, which is, when you get your medicine, for you to know, it comes with the package instructions, what to do and what not to do on your pill bottle. So, call your providers also right if any of these problems occur. All right. So, such as you're going to have allergic reactions, happen rarely, but can cause symptoms such as low blood pressure. Remember, I read up before just a minute how it got higher blood pressure just a little ago. But if you have allergic reaction, your blood pressure can come down because of causing it, maybe trouble breathing, things like that. Eyes, rash, breathing difficulties, and swelling. It can happen after the first dose or any time when taking Keppra. So this can be life-threatening. If these symptoms occur, get medical help, of course. Call 911 right away because it's very serious. Seizures are not something to mess around with, whether they're small, big, tiny, constant. You don't mess with those seizures of any type or anything with epilepsy. I don't care how small it is or how tiny it is or how big it is or whatever. Always call 911. It's better safe than sorry. Because let's say, no, they're okay. No, that person can be okay, whatever. It's like, and then all of a sudden you don't call the 911 and let's say something happens to them and you can't bring them back. All right. For example, like me, my seizures, I turned blue all 3 times. My last one, I was intubated. I've had to do CPR me all 3 times. I was intubated. I didn't come to until the next day. I wasn't responding or anything. I was unconscious. I was having a machine breathe for me, basically. But thank God for bringing me back to life, and the doctors and EMS and all those people that took care of me. So, coordination problems. So, a small number of people may have unsteady walking or coordination problems when taking Keppra. This medicine may also worsen coordination or walking problems that were present before starting the drug. Adjusting the dose of Keppra may help. So, maybe neurologist, let your neurologist, you feel funny, you're acting funny, you feel like you're unbalanced and stuff, and you don't feel like you're walking straight, you feel like you're walking like you had one too many. As for the changes in behavior, mood, or thoughts, Keppra may cause changes in behavior, mood, or thoughts. This has been seen more often in young children than in adults. Because children, they're going to act totally differently to medicines, obviously, than adults, because our bodies are growing up pretty much for the most part, and their bodies are still growing and still adapting. They're still growing their bones and all that stuff and their cells. So obviously, young children and adults taking this medicine. So the dose of Keppra may need to be lowered or stopped, basically, for your children. So examples of changes could be anger or aggression, decreased ability to cope with daily life. You may feel depressed and why is this happening to me? Why I'm over here? Why can't, I don't want to go here? I don't want to do this or anything like that. Depression, or having intrusive thoughts of doing things that they're not sure why they're getting these intrusive thoughts of why they should be here. If you ever see your children like that or anything like that, I'd suggest get some help as much as possible, whatever resources are available to you. Like I said, depression, excessive emotional reactions, or frequent mood swings or changes. If you notice total behavior changes then from their normal behavior, with children or adults, either way, try to find out, write down what's going on, and concerns and worries and what you need to do. Severe anxiety, agitation, or confused thoughts, and the last one on here, it says thoughts of suicide, as I just mentioned, basically by intrusive thoughts. That's what I'm talking about. Now, as for severe skin reactions, which they say they're rare but serious skin reactions such as Stevens-Johnson syndrome and toxic epidermal necrolysis have been reported with Keppra. These conditions may start with a fever and flu-like symptom, then a rash develops. Ulcers or lesions of the mucous membranes may be seen and develop into painful blisters. So watch out for that. All right, you want to watch out. So toxic epidermal necrolysis, it's going to be on top of you. It's going to be the skin's going to look all weird and funky and stuff like that. So watch out for signs of those if you see something like that. Report it right immediately or take care. Go to the ER right away. All right. So then it'll say then a rash develops. Ulcers or lesions of the mucous membranes may be seen and develop into painful blisters. So definitely let your neurologist, or doctor, or medical team professional know about that, because you don't want to get any worse than it already has happened. Report any fever or rash to your healthcare provider, as this can be a life-threatening condition, as I just mentioned. So definitely go to the ER, no matter what. Like I said, no matter small or big, or even if it's just the tiniest thing, they're going to deal with this, will be okay. No, don't ignore it, because if you ignore it, that small thing can turn into a bigger, much bigger problem. So, suicide thoughts and behavior. This is from the Food and Drug Administration in 2008. Reviewed data from drug studies that showed a possible relation between many seizure medicines and suicidal thoughts and behavior. You see that a lot with a lot of medicines nowadays, with any types of medicine, nutrition medicine, anxiety medicines, and so forth. And you see that quite a bit now, even on just regular medicines. The care of these thoughts and behavior are called suicidality. So, according to the FDA's alert, among the patients with epilepsy in these drug studies, more had symptoms of suicidality than people taking a placebo or inactive substance. 3.5 per 1,000 people taking a seizure medicine has suicidality compared to 1 of 1,000 people taking a placebo. So that's something to be taken into considered. It's quite a bit of difference there. All right. So 3.5 out of 1,000. That's different from 1 of 1,000 people. All right, we're taking a placebo. So watch out for that. Watching your kids, like I said, watching your kids, adults, and your family members or whoever that you may know have epilepsy or seizure disorder. What kind of changes are going on in their behavior? Write it down. Ask them. Are they okay? Tell them, don't be afraid. Like I said in some other videos, squeaky wheel gets the grease. You have to be blunt with them. So not blunt, but be kind and caring and compassionate to them, of course, and ask them what you can help them with. They may not come forward right away, but say, "Hey, I noticed this. Do you need some help with this or something like that? I noticed that's something that changed in you. Is there anything I can help you with or like that?" So, taking seizure medicines may increase the risk of having suicidal thoughts or actions. Do not make any changes to the medicine without first talking to the prescribing healthcare provider. You let them know what's going on. All right, especially for kids, younger kids. I'd say, just young kids, any type of young kids. Pay close attention to any day-to-day changes in the mood, which I just explained, behavior and actions. These changes can happen very quickly, so it's important to be mindful of sudden differences. Look at the differences in behavior, changes in the mood, and actions. Are they acting totally different from when they usually act? Are they usually a happy person and stuff, and they're excited? They like to be the attention seeker. Oh, I say attention seeker, but they like to put smiles on people's face and be just a happy-go-lucky person. And all of a sudden you say they know something different when they're being quiet, depressed, hiding in a corner somewhere, not talking much, not their cat, or they're just on their phone. I know a lot of us are on our phone and stuff like that. So obviously technology's taken us a lot of stuff, dumbed us down. I'm guessing. That's what I'm saying. Yes, probably has, but it's also good in a good way. So be aware of common warning signs that might be a signal for risk suicide. Some of these are talking or thinking about wanting to hurt yourself or end your life. All right, or them or yourself or whatever, if you have epilepsy or seizure disorder of some type. And like I said, withdrawing from friends and family, become depressed, or having your depression get worse. And like I said, this is a very common one. Becoming preoccupied with death and dying. I know a lot of people, that's a very common one from what I understand. Becoming depressed or having depression or getting worse. And becoming preoccupied with death and dying. That's very common also. Giving away prized possessions. That is like one of the number one signs right there. Giving away prized possessions. Just giving away. I'm going to give this to this person, whatever. Definitely watch out for that. That is like one of the number one things from what I've seen from people do and from reading articles and studying and stuff like that. And by the way, if you're wondering what my background is, just in case, my background is in criminal justice. So if you have any questions about criminal justice, don't be afraid to ask me. Leave it in the comments here, and I'll answer it the best I can. So, I'm 50 years old now, so I've been seizure free for 2 years now, so I'm doing okay. My voice sounds a little different now. I don't know why. Maybe because I had something to drink. Usually my voice sounds like a soft little kid, like I'm just a kid, Which I like to be a kid anyway, so it's fun to be a kid. So, play close attention to any day changes in the mood, behavior, and the actions. These changes can happen very quickly, so it's important to be mindful of any sudden difference. Be aware of common warning signs that might be a signal of risk of suicide. Some of these are talking or thinking about wanting to hurt yourself and end your life, withdrawing from friends and families, as said, becoming depressed or having your depressions get worse, being preoccupied with death and dying, and like I said, giving away prized possessions. That is one of the most common things people will do, is give away their prized possessions. Even our PlayStation or Nintendo, Xbox or whatever, Atari. They have an old Atari game. Sorry, I'm from 70s, 80s, 90s kid. So make sure you contact your healthcare provider for stopping any seizure medicines. All right. They spelled medicine wrong in here. This could possibly lead to worsening of seizure and mood. But what else is it used for? Well, it's what else is Keppra used for? Often medicines may be used for more than one purpose. It is legal to prescribe medicines for off-label uses, even though the FDA has not formally approved such use. There are no specific reports of off-label use of Keppra. So, the people who should not take Keppra. So why shouldn't they take it? Well, maybe they've taken something before. So people should not take Keppra if they have an allergic reaction to the drug or any other. It's an active ingredient. So there's an active ingredient that you need to look in there, an active, and other stuff. There's fillers and stuff like in other medicines, and they're store brand or whatever medicines you say, store brand pharmacy meds, whatever. People with kidney disorders need to be careful. However, Keppra may be given at a lower dose or prevent buildup up to a high level. Now, can it be taken with other medicines? As we mentioned just beforehand, that it can be taken with other seizure medicines. But sometimes one kind of medicine changes the way another kind of medicine works in the body. So taking Keppra does not seem to cause this kind of problem. Now, some medicines, like you can take away from absorbing your vitamins and stuff like that. They absorb it in, for example, like vitamin D or a B complex. Sometimes your medicines would take away from that. So, and that's why people are they absorb the vitamins D. That's why some people take multivitamins, B complex, and B6 is B12 complex, stuff like that. So it doesn't take away from the vitamins that you eat from your foods and things like that. So Keppra does not affect the level of other medicines in the body, and other medicines do not affect Keppra. All right, according to this. So, what is the effect of Keppra on children? So over here, this is the dose of Keppra used in children is based on their weight and age. It's usually started at a low dose and may be increased slowly to limit side effects. So this medicine is given in 2 doses about 12 hours apart. So children's bodies handle medicines differently than teenagers and adults. So the dose in young children may be different and will need to be adjusted as they get older. So they may increase it, obviously, maybe if they get older and they're having more seizures, or maybe they'll lower it or whatever. No, obviously, young children are going to have a lower dose than teenagers. Now, of course, see the package insert for details on how to start a child on Keppra and the recommended doses for their age and weight, but your doctor and neurologist will do that for you. So, what about how, if a woman is going to take Keppra during pregnancy, will it hurt the baby? So, there's quite a bit of information here of this. So, sorry if the video's long, I do apologize. It says in the United States, the FDA assigns each medication to pregnancy category according to whether it has been proven to be harmful in pregnancy. Keppra is listed in pregnancy category C. This means that caution is advised, but the benefits of the medicine may outweigh the potential risks. So this is obviously a touchy subject for a lot of women that are pregnant out there, and I can understand why. Now it says studies in animals show possible harm effects of Keppra to the developing fetus. All right, so keep that in mind. That's even though they use it in animals, but yet this needs to be studied in humans as more women use the drug. It says talk to your healthcare providers if you're pregnant or plan to become pregnant, of course. The risk of birth defects is generally higher in children of women who take more than one seizure medicines at the same time. So if you ladies out there, listen to that again. Taking more than one seizure medicine at the same time, or you have a family history of birth defects, all right? So definitely talk to your doctor about that. All women who are capable of becoming pregnant should take at least 0.4 mgs or 400 microcentigrams each day of the vitamin called folic acid, also called folate. The vitamin is thought to help prevent birth defects affecting the brain and spinal cord, called neural tube defects. The most common of these is known as spina bifida. And I've seen people, I don't know if you've ever seen people with spina bifida, it's their spine, their back, they're bent over, hunched over. It's very disheartening. So women at high risk of having a child with a birth defect, such as those with a birth defect in their previous pregnancy, are taking certain medicines, certain seizure medicines, may be asked to take 4 mgs or 4,000 mcgs daily before and during pregnancy. Talk to your healthcare provider about using folic acid and how much to take. Start taking this vitamin before you become pregnant. All right, ladies? So listen to that. Now here's the thing. It says if you're taking Keppra while pregnant, consider enrolling in the North American Anti-Epileptic Drug Pregnancy Registry by calling 1-888-233-2334. All right? So, yes, I do apologize. The video's long. I'll probably do the rest of the video tomorrow about the seniors and stuff. So some women may have more seizures during pregnancy because of hormone changes and how seizure medicine is handled by your body. Talk to your healthcare provider before pregnancy about seizures and if medicine changes may be needed. All right, ladies? So this stuff is very important for you ladies out there. Know when to check blood levels of medicine during and after pregnancy. So what your doctor or your neurologist probably will order it, and that's probably just a common thing they're going to do is check your blood levels pretty frequently. Probably maybe every 3 months, I'm guessing, or even before that, or maybe even a couple of weeks, depending on what's going on. So, like I said, know when to check the levels of medicine during and after pregnancy. The dose of seizure medicine may need to be adjusted during and after pregnancy. Breastfeeding. Low levels of Keppra may have been found in breast milk when normal doses of the drug are given. This would not be expected to cause problems in a baby, especially those over 2 months old. Keppra could affect a woman's supply of breast milk, so maybe they won't produce enough or anything like that. And yes, I understand there's lactate things out there and stuff that can't produce things, but I'm not sure how that would interact with the women's breast milk or anything like that. So, once again, ladies, take in consideration about this, all right? If you plan on getting pregnant or if you're having a baby come soon, and you have seizure disorder of some type, let your neurologist know, or your doctor, or who your care provider is, your medical team. Women who wish to breastfeed should talk to their doctor about the best medicine to use during pregnancy and when breastfeeding. All right. Once again, all this stuff is very important for all you women out there that plan on getting pregnant or are pregnant, and if you have a seizure disorder of some type, whether it's epilepsy or just a seizure disorder, because seizure disorder and epilepsy are two different things. Seizures and epilepsy are two different things, but yes, there are seizures that play a role in epilepsy. And for you guys know that. So, women who wish to breastfeed should talk to their doctor about the best medicine to use during pregnancy and when breastfeeding. So if you're going to choose to breastfeed, check the baby for drowsiness and keep track of their weight, gain, and development, especially if you're taking more than one seizure medicine. Talk to your healthcare team about any concerns that arise and if you have any problems with breastfeeding. Well, I guess I'll just go on more. I'll just finish this video up. So, Keppra does not interfere with hormonal birth control. All right, so contraception is what it says. So, Keppra does not interfere with hormonal birth control. So, what are the effects of Keppra on seniors? So, the effects. Keppra is commonly described for people over 65. When people are older than 65 or 70, their kidneys usually don't work as well as before. The kidneys are responsible for removing a Keppra from the body, so it stays in the body longer if the kidneys aren't working normally. So some people might just have one kidney, and if you guys don't know, they actually keep the dead kidney in there if you're getting a kidney transplant because it's not going to do anything. It's just going to stay there. No reason for them to remove it. And it's just tucked into there. Excuse me. Let me take a drink here real quick. That's why my voice probably found so funny. Very low dose of Keppra may need to be used when starting in older adults. The dose of medicine would then be increased more slowly. Because as you get older, our bones deteriorate and stuff, and our body is totally different. It's like we're going back in reverse, right? Is that the way they say? So sometimes a person will be asked to take Keppra just once a day. So that's where I'm taking it twice a day, the maximum 3,000 milligrams. So that's crazy, Now it says seniors may be more sensitive to the side effects of this medicine. Of course they're going to be because they're much older and their bones, are not as strong as they used to be. Now, the side effects like sleepiness, dizziness, or loss of strength may be worse when taking Keppra. These are for senior citizens, 65 and older to 70. Now, older adults may be at great risk of injury from falls or other accidents resulting from these problems. Keppra does not interact with other medicines commonly used by older adults, so it doesn't interact with them commonly used. So what are the dose ranges for Keppra? Well, we'll look at them here just to see. This is not going to say. So the best amount is in any seizure medicine is the amount that controls seizures without causing bothersome side effects. This depends on many factors which are different for every individual, from children to teens to adults and to senior citizens. So the approved dose range of Keppra is between 1,000 and 3,000 milligrams daily. So like I said, I take the 3,000 milligrams total max. The medicine is usually started at lower doses and increased over a couple of weeks. I just started at a lower dose, but then they increased it all the way to 3,000. I think I was only at the 2,000 a day. So another 1,000, so that's quite crazy. The medicine is usually started at a lower doses and increased over a couple of weeks. Some people may be given higher doses depending on their individual situation. Now, of course, see the package insert for doses used in children, which your neurologist will explain to you, or pharmacists. And there's a place where you can read more about the studies on Keppra studies. So, other than that, guys, this is my brain wreck. So, that's basically what Keppra is and all that good stuff. And, it's something to think about. So, well, here we go. Brand names: Keppra, Spritam. And it's used to treat juvenile myoclonic epilepsy, temporal lobe, focal impaired awareness, or complex partial seizures, myoclonic seizures, secondarily generalized seizures, bilateral tonic-clonic seizures, focal aware onset seizure, and tonic-clonic seizures. So we got 250 milligrams, 500 milligrams, 750 milligrams, 1,000 milligrams. And then the liquid solution, liquid injection. I didn't know there was an injection, so there's an injection, I guess. As for the spare team tablets for oral suspension, 250, 500, 750, and 100. So now a lot of people ask, what if I forget? So taking the right amount of seizure medicine on time every day is the most important way to control seizures. Try these steps to help you remember when to take seizure medicine. So I'm going to read these here. If you miss a dose, take it as soon as you remember it. If it is almost time for the next dose, skip the missed dose and go back to your usual schedule. Avoid taking 2 doses at the same time or taking extra doses. So do not take extra doses, all right, people? That's very important because if you take extra doses, what's going to happen to you? You're going to overdose on that probably, and something could happen to you, and you're going to go to the hospital, and they may have to give you charcoal. And if you guys know what charcoal is, they'll give you liquid charcoal because me from being my criminal background, criminal justice background is I used to work in a hospital. I worked for the city, so I was paid by the city, whatever, and so I got to deal with a lot of drunks and people with overdosing and stuff like that. And yes, I've had charcoal thrown at me. It's not what it says. It's charcoal. It's charcoal. And yes, you can buy charcoal tablets in the stores and stuff like that. If you're not sure about what to do, call your healthcare provider's office for advice. Do your best to follow directions. To avoid missed doses, use a pill box or set an alarm on your watch or phone. Set reminders control to yourself with online seizure diary or text message system like texting for control. Ask your pharmacist to pre-fill the medicine in blister packs. So you guys aren't blister packs. Those are little pills that are, little silver things. Write down any missed doses in your seizure calendar. Share this with your healthcare provider at each visit. So there you go, guys. Hope you find something useful out of this. And like I said, if you want to learn anything, or if you found something useful for me, or if you have a question for me in criminal background, for my background criminal justice, let me know. I'll answer your question on here too. So appreciate watching my brain wreck. Like we said, all of us that have seizure disorders or epilepsy, all our brain took a wreck because we got short circuited like Johnny 5, our show is short circuit. So thank you for watching my brain wreck. You have a great day. Like, subscribe, press the bell button for all subscribers. See, look at that. It's going to show you that our medicines can affect us, or we just forget, or it's just because of my age. No, I'm just kidding. So I'll click down the bottom right hand corner of your screen there and click on the little skull person there, whatever it is, and you subscribe that way. Thanks for watching. This has been my brain wreck.